Chapter 52, Inflammatory Joint Diseases and Genetics. And this is specific training for rheumatoid arthritis and specifically the joint sensor genetic test. And you will find this test here in our portfolio. And as you can see here, it's meant for prevention and treatment. It does not give you any specific benefit in early detection or early diagnosis. So really it's for people that want to prevent developing the disease, but it's also useful for people that already have the disease. Now let's look at the concept of inflammatory joint diseases. This here is maybe a joint of a finger. You have two bones and they have cartilage as a sort of lubrication between. And what happens in inflammatory joint diseases is that it's usually the immune system that attacks the cartilage. So for some reason the immune system thinks the cartilage is a bacterial infection and starts fighting it. And this cartilage is then broken down progressively until in very severe cases the bone can actually rub against each other. This causes deformation of joints, obviously pain, and loss of function of these joints. And this is what rheumatoid arthritis is about. Now, the aggressiveness of this immune system is modulated by genes. So, and these are some of the genes. So, for example, the TNF-alpha gene. Just so you know, this is something cut out from a report, so you will find this information in the reports. And if you don't know what this table means, please do watch the simple disease risk statistics training that will explain you everything about it. But here you can see how common the genetic variations are. So 2% have the AA genotype and a 7.29% risk of developing rheumatoid arthritis, so 7 times higher risk. And the interleukin 6 gene, the CC genotype, has no risk, and others have 1.36 risk, but also a 7-fold risk of degenerative disc disease. And this is the science behind it. And this X here means this is the result from this one person. So in case you're interested, you can look into it. It's usually too technical for patients. I would just show it to them in this form. So you have this bar. This is the normal risk, the best genetic variation, and it could go all the way to here with a very high risk. And again, this table will be explained to you in the simple disease risk statistics. So here we find out you have a low risk or a very high risk. If it's a very high risk, it's very important for you to follow these recommendations. At low risk is less important. And also the same for degenerative disc disease. This is independent of the risk of rheumatoid arthritis. So this person has a very low risk. And then there's the prevention. Depending on your genetic risk, we would recommend other things, and these things would be more important for you with a higher risk and less important for you if you have a very low risk of developing the disease. So it's very simple to understand, so look through a report and read through it once so you know what kind of things we're recommending. I'm just summarizing it. For one thing, you should practice sports as prevention that do not challenge the joints. So really do sports like swimming and less of weightlifting, where you really challenge the joints. And it's better to do exercise early in the morning than later in the evening. By doing this light exercise, you will actually keep your joints active and you will protect your joints. And then nutrition is a very big important aspect, because there are certain substances in food, arachidonic acid, especially in animal foods, that cause inflammation. They're kind of batteries for the inflammatory processes. So if you eat lots of arachidonic acid, you will make your immune system more aggressive and you will speed up or cause these problems of joints being attacked by the immune system. Then omega-3 fatty acids have shown to reduce the aggressiveness of the immune system. So by taking these fish oil capsules, for example, you reduce the aggressiveness, you slow the progression, or you reduce the likelihood of the disease from developing. Now there's one important thing. Omega-3 fatty acids might be negative for you for your HDL cholesterol. If you haven't heard about this before, do watch the cardiovascular sensor training. There I explain that for some people, depending on genetics, omega-3 fatty acids make cholesterol worse or better, the HDL cholesterol, depending on genetic variation. So in the cardiovascular sensor, you might not be recommended to take omega-3 fatty acids for the cholesterol because it's bad, but you might be recommended to take it for the joint diseases. Now, that's the problem, because it might be bad for one disease but good for another. So it must be decided if you have a very low risk of HDL cholesterol problems and a high risk of inflammatory joint diseases. I would recommend it because of the beneficial effects in this area where it's more important. Otherwise, if you have a very big problem with the HDL cholesterol and virtually no risk in inflammatory joint diseases, then I would not recommend it if it's negative. So you need to take everything into account. Alright, unsaturated fatty acids are to be preferred, and omega-3, as I said, is anti-inflammatory. So nutrition will be adapted. And this is part of the nutrition sensor. So if you have a high risk, the nutrition sensor will really help you choose foods which contain low amounts of the bad stuff and large amounts of the good substances that improve your immune system. And then it's important for early detection to get immediate treatment. So the recommendation is to consult your doctor as soon as you identify the symptoms, which are morning stiffness in hand and fingers, circulatory disorders in fingers, so some fingers remain colder, for example, or back pain. And this should make sure that, especially if they have a higher risk, that they will look out for these symptoms and then talk to you as a doctor to get the right treatment right in time. And this is the end of chapter 52. It's about joint disorders. And one aspect that I also want to mention, please do watch the pharmacogenetics test training, because there you find out how certain drugs are metabolized by the body, how some drugs might not have any effect, some might be required at lower dosages because the body can't clear it fast enough. Because in this respect, this is also an important part of this test, we do find out which drugs work better or might not work at all in individuals. So we test a certain recommended or necessary pharmacogenetics genes, and then we find out the common drugs that are used. This one should be used at half the dosage because the body clears it too slow. This drug should not be used at all because it's not broken down by the body, and this drug might be safe to use. So really what we can do here is we find out the risk, we change nutrition to help either prevent it or manage it when it already has occurred. And then when it has occurred, we also give you guidance on what drugs are more effective and which are less effective. And as I said, please do watch the pharmacogenetics training to learn more about how we can improve medical treatment for certain things. And that's the end of chapter 52, Inflammatory Joint Diseases and Genetics.